Hi, I'm Dr. Chris Collar. Today I want to talk to you about the functional medicine paradigm. That is, how do functional medicine doctors view human health and why we get sick? There's a few steps that I want to explain to you. I'm going to use a whiteboard to demonstrate. Most of us get sick because of toxins in the world. Toxins are things like bugs, viruses, bacteria, fungus, molds, parasites, things that exist in the environment that we catch. Other toxins are things like medications. Medicines have a positive role in certain circumstances, but long term, they can be damaging to our bodies. In particular, things like steroids, antibiotics, and other medicines that you see on TV certainly have a host of side effects. Toxic metals. Metals are things like lead and mercury and arsenic, cadmium and aluminum. These are in our environment. We get exposed to them through our drinking water, through our foods. If you smoke cigarettes, you're likely to have high lead and cadmium. Certain work environments can also get you exposed to certain toxic metals. Diet, food, water, the various things that we put into our mouths can make us sick. There's a lot of high fat, high salt, high sugar diets that people are eating. And then certainly the herbicides, pesticides, GMOs, and those sorts of things can be damaging to us. Now these are just a few examples of different toxins that exist in the world. They mostly get into our bodies through our mouths and land in our intestines, where 70% of your immune function is. Your body spends a lot of energy trying to keep your digestive system healthy. So as we ingest these different toxins, a few things start to happen. You may have heard about probiotics. Probiotics are beneficial bacteria that help maintain the health and integrity of our intestines. But one of the things that toxins do is they start to kill off beneficial bacteria. This leads to a bacterial imbalance problem. If we kill off beneficial bacteria, sometimes that will result in yeast, in particular something called candida, overgrowing. Essentially, if we kill off the beneficial bacteria, then the yeast who live next door say, hey, everybody's moved out, we can start to grow and replicate and take over larger amounts of territory inside the body. So that's why probiotics can be helpful at combating yeast overgrowth. Now this starts to lay the groundwork for a problem you may have heard of called leaky gut syndrome. The technical term is intestinal hyperpermeability, but we call it leaky gut because it's easier to understand that way. Leaky gut sounds kind of funny, but what it means is your intestinal lining is like a screen that keeps bad stuff out, but allows the vitamins and minerals and other good things to get into your bloodstream. Leaky gut means we start to tear holes in our screen, and now the particles that should be leaving have a chance to get into the bloodstream, causing inflammation. So leaky gut means absorbing in, not so much leaking out. Okay, that's kind of critical. When this starts to happen, it's thought that some of those particles might become triggers for food sensitivities. This is a little bit different from allergies. Normally when we think about a food allergy, we think of eating a peanut, then you get itchy and swollen and you get hives and you can't breathe. You know, that's an allergy. It usually happens pretty quickly after ingesting some allergic food. Food sensitivities are a little bit different. These are harder to pinpoint because they're delayed. You might eat a peanut and then maybe a few hours to a couple days later, maybe you have a headache. Maybe you're more irritable. Maybe you don't sleep well. Maybe your irritable bowel syndrome gets a little bit worse and you get diarrhea. Maybe a rash pops up. There's a whole host of symptoms that can be associated with food triggers. And in my practice, I've seen all sorts of different symptoms go away simply by identifying food sensitivities and avoiding them. So this is one of the aspects of functional medicine, mostly having to do with the digestive system, because so much of it of our health depends on the health of our immune system, of our digestive system. in particular autoimmune conditions, irritable bowel, all sorts of other things. If we get the digestive system working right, then other things start to fall into place and we can address those more specifically. So this is our first look at the functional medicine paradigm. In the next section, I'll talk about what sorts of tests we might do to explore what's going on in a particular patient.